Now, if you're someone that recently had a hip replacement and you're suffering from hip pain, stiffness, or maybe even fear of putting full weight on that leg, don't worry, because in today's video, I'm going to show you the most effective exercises that you must be working on after hip replacement. Let's get started. Welcome back, guys. It's Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, I've treated many patients right after hip replacement, and I firmly believe that the selection of exercises that you choose will help dictate how your recovery is going to go and will help determine how confident you're going to feel in that hip again. Let's get into the most effective exercises that you can begin now. All right, we're going to get started now. If you're someone that has been to my channel before, you know that I greatly believe in flexibility and having optimal mobility before we start our strengthening. So the first exercise we're going to teach you is going to focus on your hip flexibility. This is often a marker that often gets missed, and many people want to just jump into the strengthening exercises. So we're going to say, for the purpose of today's video, that with this particular exercise, this is the surgery hip that we're focusing on. So I'm simply going to focus on bringing the leg straight out just like this. You're going to obviously be doing this on your bed here, and then you're going to take the opposite leg and you're going to bring it up toward your chest. Now, some of you may be thinking, what is this actually doing? Or have I seen this stretch for my lower back maybe? But actually, this is a great stretch to help lengthen your hip flexors and your quads, especially on that leg that is down. So this leg, you're bringing your knee up as far as you can, taking it into hip flexion, but then this opposite leg is going into hip extension, which you're gonna really need in order to stand up straight and really focus on improving that stride when you're walking. So you can focus on this stretch for about 30 to 60 seconds, 2 or 3 times, and you're only gonna be really focusing on this left side right after surgery, because it will be difficult to try to get that leg up. And some of you, depending on what type of procedure you had, might still have those hip precautions in place if you've had a posterior approach. But either way, you're going to be bringing that right knee up towards your chest if this is if your left leg is the surgery side, and you're focusing on keeping the knee down on the bed as far as you can, and you're trying to just keep your body nice and lengthened so you feel a good stretch through the top of the hip there. The next exercise we're going to move on is the straight leg raise. This is greatly effective for building quadricep strength, and the reason why that's important after hip replacement is that quadricep muscle attaches at the kneecap but goes all the way up and crosses the hip. So if you're just focusing on hip exercises, you're really not focusing on the entire rehab program, because the quadriceps is involved with this recovery. So you're simply going to focus on getting a nice quad set or quad contraction, bringing your toes up, which will help facilitate that contraction, and you're going to bring that leg up, keeping the leg as straight as possible. Your leg's going to be shaking like crazy. You can bring it up to the level of your opposite leg, and then most importantly, with that eccentric lowering, you're going to control that movement down. So you're going to go about 10 reps, and this one you can perform on each side where you're going up and down. Not only do you get the benefit of strengthening the quadriceps, you're getting some good hip flexor strengthening as well, and even your lower abdominal. So a lot of benefits to this particular exercise here. So the next exercise we're going to move on is the glute bridge. Here we're focusing on the posterior chain, so your hamstrings and your glutes are going to be extremely important in your recovery after a hip replacement. Now, hopefully you've already been working on just tightening your glutes and working on glute squeezes to help get some isometric contraction of those glute muscles. But to level up this exercise, you can really work on sliding those feet as far as you can underneath your knees, just like so. And now you're gonna do is you're gonna squeeze your bottom by tilting your hips backward and lift those hips up as high as you can towards the ceiling. Then you're gonna lower back down just like that. You can also bring your hands down at the side. Once again, work on tilting your pelvis back towards you, lifting those hips up, and then come back down. You can feel your pelvis kind of tilting as you initiate the exercise by actually focusing on your abs kicking on and your back kind of almost flattens towards the ground. So you're gonna lift your hips up just like so, and then you're gonna come back down, okay? All right, the next exercise we're gonna get into is a sideline clam. Now, in this position, because I'm facing the camera, we're assuming that this is the surgery side. So this is the side that's going to be on top while we're starting off. And here you'll notice my knees and my feet are together, and my knees are kind of at this angle here. So now I'm gonna focus on really feeling a contraction on the back side of the hips. Now here we're focusing on the glute abductor muscles. It's a smaller muscles, but is responsible for a great amount of stability in the pelvis and the hip. And all I'm gonna do now is keeping my feet together. I'm gonna raise my knee up towards the ceiling, and I'm gonna feel this muscle back here kicking on, okay? And then you're gonna lower back down, okay? We're using this exercise to help get some facilitation on the back side of the glute there. And this is kind of like this short lever position. So some of you, this may be a perfect area to start with. It might even look like smaller range of motions. Maybe you're not able to raise up as high. Maybe you're just focusing on just small ranges of motion. And then as you get better with this, you'll be able to raise the knee higher. And then if this is too easy, you can always now take that top leg and now extend it out to the side. So now my toes are slightly pointing down towards the ground with that hip in that internal rotation, so that there's a difference between my foot going up and now my foot going down, which is where we want you to start here. You're still now staying on that side, just like that previous exercise, but now we're taking that foot up all the way up to the ceiling, really trying to keep that leg straight while feeling a good contraction of the hip. And most importantly, we're focusing on the nice, slow control on the way down, okay? With both the clams or the hip abduction, we can work on 3 sets between 10 to 12 repetitions at a time, okay? All right, so now that we've taught you exercises that you're usually gonna start with in the bed, in order to really gain some confidence on putting some weight on that leg again, you have to perform exercises that transition you into a standing position. So we're gonna go over 3 exercises that are gonna be super crucial for helping you regain the confidence to put weight on that leg again. So the first one we're gonna start off with is a 3-way step or a 3-way weight shifting exercises. Now rest assured, with all of these exercises, you're gonna be able to progress these effectively, and I will show you some tips on how to level each one up. But in the meantime, let's get started. You can be performing this, obviously holding on to something for support if your balance is not as good. But the first exercise we're gonna start with is going to be that weight shifting. So we're gonna go in 3 different directions here. So you're gonna step forward here, now we're gonna step to the side, and now we're gonna step backwards. And you're probably asking, which leg am I gonna do this with first? And how many should I do on each side? So I'm working on anywhere between 8 to 10 reps in each direction, where I go forward, laterally, and then while I go backward. And you're actually gonna benefit from doing both legs, because now as I'm shifting, even if this is my hip that I got replaced on, I'm shifting my weight to my front leg away from that side, and then I'm learning how to accept weight again. Once again, as if I'm going laterally, I'm shifting my weight off that surgery leg, and then I'm learning how to accept weight on that again, okay? Then I'll take my weight backwards and then forward. And then here, we're gonna switch legs. Now it's gonna feel a little easier because now I'm primarily balancing on the non-surgery leg, but now I'm gonna require the surgery leg to be more active by stepping forward and backward with this movement. Now, as you progress and you get better with this, you can really start to challenge yourself. Maybe you have returned back to the gym and you're starting to get more comfortable with maybe stepping out into a lunge, kind of like a side lunge, even like a backward lunge, okay? I don't want us to get ahead of ourselves right now, but just know that that is an option. Once the stepping becomes too easy, you can go to this option. Next, we're gonna work on the march. The march is such a simple exercise, but can really teach you how to weight shift your body from one leg to the other, and really not only can challenge your balance, but really your hip stability. So you're gonna focus on maybe 10 to 12 reps on each side, And obviously the higher that you lift your leg, the more that leg that is down on the ground has to work to keep you stable and upright. We don't want our hips kind of caving in or letting the hips drop. Try your best to imagine that belt line staying nice and equal as you're lifting. And maybe you're doing this with one hand at a time for support. But as you get better with this, you can really focus on your balance, really trying to lift that leg up, really feeling that leg feel strong and stable, working those hip stability muscles, because this is ultimately what's going to help you with getting in and out of the vehicles, maybe even stair stepping, going up and down curves. Super functional exercise here, okay? The last exercise that we're gonna go over that is implemental in getting you strong again for that hip is starting to incorporate some squatting. Now, before you guys say, well, that's way too much for my hip, I cannot tolerate that, just know that in previous videos, I have gone over the box squat. This is where you're actually sitting back down towards maybe a chair or a box, which is usually a little more elevated, so it's a little easier to sit down on and you're not dropping your hips as far. But if you feel like you're not having a lot of pain and you can tolerate a lot of the activities that we're going over, I would highly recommend even challenging yourself by working on between 10 to 12 repetitions of a mini squat. So what you're gonna do is you're gonna get your feet in about hip width apart, okay? And the first thing you're gonna do is you're gonna actually bring your hands out in front of you. This is going to allow you to keep yourself stable and balanced. So as your hips are shooting backwards, your hands are counterbalancing yourself so you don't fall backwards. And you're gonna sit down as far as you can into the squat. Notice that my hips are going backward and downward versus some people you'll see they go into a squat and the first thing they do is they just drop straight down and their knees are maybe having a lot of pain or maybe their hips are feeling a lot of pressure. But just make sure that you really think about shooting those hips back, almost like you're reaching your bottom back into a chair as your hands come out in front of you. And then over time, as you get better with this exercise, you'll start to feel how easy it is to sit further and further back into that squat. And you really want to emphasize standing all the way at the top. And this is going to really build glute strength, quadricep strength, which is going to be super important after a hip replacement. There you have it. Those are the most effective exercises that you need to be working on after hip replacement to help ensure you have a full and smooth recovery. Now, if you are someone that is suffering from swelling after this procedure, take a look at the video I made here on how to manage your swelling well. In the meantime, if you want more tips on how to build strength and longevity with your body, please consider subscribing to the channel, and I'll see you in the next one.